When is myringotomy needed for ear infections and hearing loss? Imagine feeling constant pressure or hearing muffled sounds that just won't go away. Sometimes, when ear infections stick around or cause significant hearing problems, a tiny surgical procedure called myringotomy might be the answer. This procedure involves making a small cut in the eardrum, also known as the tympanic membrane, to help drain fluid from the middle ear and relieving pressure. It is most often used when ear problems don't improve with usual treatments or when fluid buildup causes hearing issues. In cases of persistent fluid in the middle ear lasting more than 3 months, myringotomy is often considered. This fluid, called otitis media with effusion, can linger after an infection clears and may lead to hearing loss. Especially in children, prolonged fluid can affect speech and language development, so timely intervention is important. If a child has had 3 or more ear infections within 6 months or 4 or more within a year, doctors might recommend myringotomy, sometimes with the placement of tiny tubes called tympanostomy tubes. These tubes help keep the middle ear ventilated and prevent fluid from building up again. Severe ear pain or pressure that does not respond to medication is another reason for this surgery. When antibiotics or pain relievers fail to bring relief, draining the infected fluid through a myringotomy can provide immediate comfort. Additionally, if hearing loss exceeds 30 decibels in the affected ear and is linked to fluid buildup, this procedure can help restore hearing. It is also useful when structural changes like scarring or retraction of the eardrum occur due to repeated infections. Sometimes, myringotomy is performed to obtain a sample of the middle ear fluid for testing, especially if the infection is not responding to treatment or if the patient has a weakened immune system. Often, the procedure is combined with inserting a tympanostomy tube, which stays in place for several months to keep the middle ear drained and ventilated, reducing the chance of future infections. Overall, myringotomy is a safe and effective option for many people suffering from ongoing ear infections or fluid-related hearing loss. Most patients experience improved hearing and less discomfort afterward. Like any surgery, it carries some risks, including infection, bleeding, or, rarely, a persistent perforation of the eardrum. It is important to remember that not every ear infection or hearing loss requires surgery. Many cases resolve on their own or with medication. The decision to proceed should always be made after a thorough evaluation by a healthcare professional who can assess your specific symptoms, medical history, and hearing status. If you are experiencing persistent ear problems or hearing difficulties, consult your healthcare provider to explore the best treatment options for your situation.